AAKP was created in 1969 by 6 dialysis patients at Kings County Hospital in Brooklyn, New York. At the time, dialysis patients had to have treatment anywhere from 12 to 18 hours a day, 3 days a week. It was lonely and time-consuming. These patients knew there were many people like them across the country and wanted to organize. They wanted to give kidney patients a voice in the government, raise money for research and development, and bring awareness of kidney disease to the general public. Kidney disease affects more than 26 million Americans. This includes more than 500,000 people on dialysis, 100,000 people waiting for a transplant, and another 100,000 living with a kidney donated by a family member, friend, or anonymous donor. At AAKP, we educate patients and advocate for them. We do this by developing educational programs and events that are patient-centered and achieve results. We also raise awareness of kidney disease and its complications, and give doctors tips on what they can do to help patients make better health decisions. AAKP is recognized as the leader for patient-centered education. We believe patients who understand their disease, in partnership with their healthcare team, have a better quality of health and improved quality of life. We're leading the effort to bring the kidney community together to promote conversation and seek out services that improve patients' everyday lives. We want patients to have the ability to take charge of their health. AAKP brings more than 45 years of experience educating and advocating for kidney wellness. We're engaged with more than 1 million patients and caregivers, and we've shown that we can improve health outcomes in patients at risk for developing kidney complications by creating replicable and scalable interventions. 2 of our successful education programs are Kidney Beginnings and our AAKP Healthline. In these programs, participants learn from healthcare professionals and from fellow patients. We teach them how it's possible to slow the disease progression and encourage them to actively participate in healthcare decisions. We have several tools in place to monitor the number of people who order our educational brochures, attend our educational programs, or download material from our website. But one of our most important metrics is the number of patients who take action afterward. So we track the number of people who talk to their doctor about a treatment modality, or their social worker about their state of mind, or a renal dietitian about their diet. These are patients who are now actively improving their health and quality of life. AAKP is often confused with other organizations. Although many kidney organizations have overlapping goals, there are several things that make AAKP unique. Most importantly, we're a patient-based organization. We make sure that all decisions are made with the thought of improving the quality of life for all kidney patients. Also, a lot of organizations focus on research or funding, but we want patients to be educated so they can take active roles in their healthcare. Because in the end, it's each individual who should be responsible for the decisions that affect his or her life. One of the most dramatic moments in our history was when our then Vice President Shep Glazer was dialyzed for a few minutes on the floor of Congress. We wanted to show that not only was dialysis a life-saving procedure, but individuals who were receiving the treatment could go on to be productive members of society. It was also a major factor in the Medicare law that guarantees dialysis services for anyone with kidney failure. This program has prolonged millions of lives, and we're proud to have been a part of the effort. Kidney disease is a silent disease, and kidney patients don't look sick. For most Americans, it's not at the top of their mind. And because there isn't a major campaign regarding kidney disease, the public's knowledge of the disease is minimal. This is unfortunate because hundreds of thousands of people will only learn they have a problem with their kidneys when it's too late. Over the years, we've heard hundreds of stories about people learning that their kidneys are failing after they've woken up in a hospital with a catheter in their chest and hooked to a dialysis machine. That's why we want people to be aware of the risk factors very early on. One program that we'd like to see developed is called the Physician and Patient Partnership. This would target family care physicians. Unfortunately, doctors often miss the early signs of chronic kidney disease. But our project would provide education for physicians on the conditions that can lead to CKD, how to manage those conditions, the side effects, and dietary requirements. We want to be a resource for patients and doctors. More than 25 million people in the U.S. are affected by kidney disease. Another 20 million people are at risk of developing kidney disease, and most of them don't even know it. They don't know their risk factors, and they don't know the early signs. We need a national marketing campaign that identifies the risk factors of kidney disease. The campaign needs to identify possible symptoms of kidney disease and ways to slow its progression. Creating effective health messages and rapidly adapting them to appropriate audiences is essential to reducing the number of people affected by kidney disease.